I am recording this webinar, just so you know, and this will be posted on YouTube in about a week or so. We are going to be providing CE from the Medical Library Association, and I will share that link in an email after this webinar is over. Let's see, anything else? My name is Bobby Newman, and I'm today's host for the webinar. I'm going to go ahead and let Francesca share her screen, and we're going to go ahead and get started.
Okay, thank you, Bobby. And I'm going to pull up my PowerPoint here, and we will have a webinar. So hi, everyone. I don't care when you ask questions. That's just great. If you have questions or comments at any time, go ahead and put them into the chat queue, and Bobby will be paying attention to it. So don't expect that I am paying attention to it and will answer the question immediately, but you will get an answer very, very quickly. Today's topic is collection management for healthy communities. And of course, it's aimed at public libraries. And I am having trouble going forward. Bobby.
Do your arrow keys work?
My arrow keys are not working, which is an interesting part. Here, let me.
There you go.
Okay. So sorry. Okay. As today's discussion focuses on how public library collections address many health-related needs and interests. Librarians and many others look to resources for information in response to questions about disease, wellness, chronic conditions, prescription and non-prescription drugs, and different kinds of therapies. To provide accurate and valuable and correct support for these information needs, the print, media, and online collections on which your public library relies has to be cultivated with new resources added and outdated ones weeded. So that's what we'll be talking about during the course of this hour. My name is Francesca, as I've already been introduced, and I've developed and taught curriculum for library staff relating to delivering health information to community members in a number of different geographical areas, some of which have excellent access to rich resources, and also in isolated places where both budget and online connectivity are badly underdeveloped. So I do feel like wherever you're coming from, I probably have met people in that situation before who are trying to deliver good healthcare collections. So please feel free to ask questions or make comments as we go along. Although we can't all introduce ourselves, I want to welcome you all. There are about 70 of you here, and hope that you will be willing to share your own experiences as well as your questions so that our time together today enriches all of us. So let's start with both the purpose and the presentation of the collections we provide community members. We need to make sure that those collections are evaluated for their authority, accessibility, their fit to our specific community and its micropopulations, and staff capacity and understanding of how library value is added to the collections through our service points. So when we talk about those collections, we're talking about collections that are stored or made available in different parts of the library with different end uses in mind, such as reference materials versus circulating materials. And we're also talking about collections that may be physical collections, but also collections that may live only online or in another medium besides print. The reference collection, no matter what topic is being covered, health is just one example, addresses essential information needs that many in your community may need to consult simultaneously. So instead of having materials only circulating, you've got a collection that is always available for your community to turn to, but also includes information that your community may need you to act as an intermediary in order to make that information useful to them. There's ready access to evidence-based science and authoritative guidance for decision-making in your reference collection when it comes to health. There is material that is organized in a way that staff really does need to provide that guidance, because we can't expect everyone in our community to understand how to use a work that has multiple indexes, just for an example. And when we talk about any public library setting, we're always talking about a local library and its various local issues. So one of the things that's probably in larger libraries or county libraries, if you're in a county public library situation, include environmental impact reports. And those clearly can have health and wellness implications in them. We also, through our reference services, offer directory assistance for finding health services, not just for immediate health care, but also things like planning long-range elder care for someone who may live outside of the area, whom you can't go and actually physically help, but you can help them remotely at your public library. In the circulating collection, we have also aspects that are addressing different population groups. So in addition to materials and databases and even suggested websites that are appropriate for adults, we also keep collections for kids, for teens, for people who speak languages other than English, and for a variety of media strengths. So people who would prefer or rely upon audio or audiovisual information can also receive it in the circulating collection, as well as those who look for the traditional print. The kinds of things that people are looking for in the circulating collection include things like diabetes support diets and different HIV treatments, how toxic chemicals in the workplace and in cosmetics might affect them, sports injury, exercise regimes, and all of these and more become dated. So keeping the materials in your circulating collection up to date is just as important as keeping those in your reference collection up to date. Multiple formats and styles allow different community members to access information that's essential to their health needs and interests. Keeping older materials in your Spanish or your Vietnamese or your Chinese language collection is frankly unethical. Everyone should receive equitable treatment from your collections as well as from your service points. And here on this slide, one of the important elements that you see is a definition of health literacy itself. Studies have shown that your garden variety literacy, that is your capacity to read and evaluate political news or the instructions for using your new blender, really don't translate necessarily over to you having the same level of health literacy. So keep in mind that even people in our communities who are relatively well educated, who may lack specific education in the health field, may have the sorts of literacy issues that you would otherwise not consider them having if it were coming to something like needing repair manuals for their automobile or needing directions to bake a cake. This particular definition is used widely, and you'll probably see it in every webinar on health and wellness that you attend. Whether we're talking about the reference collection, an adult or youth circulating collection, a video collection, or even the databases to which your library subscribes, evaluation needs to be ongoing. We need to be able to evaluate the authority, the currency, the audience accessibility, and the appropriateness to your collection's profile have to be considered and reconsidered on a regular basis. one of the issues that comes up frequently is I've put a whole lot of money into buying these materials or into paying for this particular service. So I have to keep it. I can't afford to get rid of it. When it comes to health and wellness, past costs should not be a factor in current retention if the content no longer passes muster in these other criteria. And you can think of a parallel to this. Think about the last time that you went out for a really spectacular dinner in a restaurant. And maybe you're a meat eater and you ordered a fantastic steak and you had a bottle of champagne. And you weren't able to finish the steak and not all of the champagne was drunk. So you took those home with you. Now, if you turn back to that leftover steak and that leftover champagne a few days later, not only will it have degraded horribly, but it could actually be they could actually be injurious to you. You have to be able to think of your health and wellness collections in the same way. There's no reason to preserve them beyond the time that they can deliver what you bought them for in the first place. And if they're no longer useful, they can be harmful. It's best if you don't consume them. Your community doesn't know that, and they don't necessarily know how to judge whether the material is out of date. So it really is up to us to keep our health and wellness collections judiciously weeded and make sure that we're not serving week-old steak or 3-week-old champagne. Okay, but what about health books? There must be some place for paper in our collections. There actually are. There are very few, but there are a few, as long as they reflect current evidence-based information and or current practice, and the terminology that they use reflects our current awareness of disabilities, gender identity, and other aspects of personal status. And this means that very, very few traditional paper health and wellness books are going to pass muster. And the chorus at the bottom is something that I know all of us have said at one time or another, as well as heard our coworkers say. But that's what people want. They want books. We'll get to that. And I don't actually believe that's true anymore at all. There are some books that are worth keeping. Certainly having the latest human anatomy works on hand. For instance, Gray's Anatomy is in its 20th edition, so if you have that, do keep it. The most recent editions of your state's codes, legal codes that refer to health laws and public health laws. If legal codes for your state are part of your general collection, they should always be up to date. And you should think of any of the state codes that have health references as being part of your health collection, as well as part of your legal collection. In your circulating collection, cookbooks that are currently listed as high value by the American Heart Association, you certainly should keep. You should revisit them and the American Heart Association's advice on a regular basis. However, cookbooks that are for diets that are either fad diets or diets that were popular 5 years ago, 10 years ago, and have very little basis in science, if any at all, do not deserve a place in your collection from a health and wellness perspective. If your library happens to be a resource for cookbooks for your entire area, you may end up keeping them, but please try to make sure that people are not relying on the ones that claim to have health or wellness benefits. Make sure that your users are aware that that might not be the case. Youth collection books that have to do with health and wellness include books about the body, the human body, as well as animal bodies, puberty, and chronic diseases of childhood like asthma. These are books that are written for kids and teens and are well reviewed. They should also be less than 5 years old. They should be less than 5 years old, not only so that the health information is current enough to be useful, but also because in books for kids and teens, a book that's older than 5 years that is giving non-historic information will tend to look very dated after 5 years. And I don't just mean what the kids in the pictures are wearing, but also just how information is displayed. As we all become more and more attuned to collecting our information online, kids and teens are scanning book information differently as well. And so newer books are laid out in a way that has that understanding behind it. Ones that are older tend to look too old to be useful, whether or not they are to the discerning teen or older child. Just because information lives online doesn't automatically imply that it's current, of quality, or has a good fit to the user. Evaluate and reevaluate your databases and any websites you use and refer your community to use. Make sure you know the ones that widely publicize themselves but are in fact of poor quality, such as WebMD, which has posters advertising itself in doctor's offices, for instance. You can test how authoritative it is by trying to find when the information in it was updated. You'll have considerable difficulty. And in terms of access and level of understanding that users need to bring to it, winnowing out what was said by an expert versus what was said by somebody who is a quote unquote doctor, but perhaps not in that area of expertise, is very difficult to do in WebMD too. So generally avoid that when you can. Be prepared to teach the skills that your community needs to navigate complex and valuable websites and databases. And that you do that best, of course, by learning how to do that yourself first. So back when we were talking about, don't people really just want books anyway? Be honest with yourself. Are you actually saying, I'm more comfortable using print information? These websites, these databases are all set up differently. It's going to take me a long time to become proficient at using them. Instead of worrying about it, jump in and start making yourself proficient. And you do that with practice. So where can you find authoritative health collections? Fortunately, there are a whole lot of free ones out there. So what we have available isn't going to cost more money in terms of materials. It may, in fact, require that you have more public access computers and spend more staff time helping people with navigating databases and websites. But it's not as if you're being asked to get rid of thousands of dollars worth of books and replace them with thousands of dollars worth of books. I'm going to move to a different screen now. So just a minute. And let's see. You're all being so patient while I try to get myself to the right screen. Okay. The Public Library Association, working in conjunction with the Medical Library Association, has developed healthy communities healthy community tools for public libraries kit. Has a large range of resources. When you get the PowerPoint that I'm showing today, you'll have the URL for this, so don't worry about it. has a huge range of programming ideas, but also among its resources includes glossaries, and also includes databases. And these databases are freely open to you to use. As I said, some of them are complex, and you should take the time to learn to be proficient in them yourselves. But you don't have to come to this with the mindset that this is going to cost a whole lot of money to rebuild your collection. Because in point of fact, you've got a lot of databases at the ready at one URL to get you started. Let's see, I would like to take you into one of them in particular, and that is HealthFinder. HealthFinder.gov is a very basic, I think of it as a health encyclopedia aimed at an adult audience, but certainly accessible by middle to older teens, that covers a huge range of topics and does it in a way that is laid out relatively simply. So if you yourself are feeling a little bit shy about becoming proficient in different databases and websites, this would be a good starting place. It's fairly straightforward. It has an enormous range of topicality, and because it's free and because it's very frequently updated, you're always going to find solid information here without paying a high price. Okay, let's see here. Whoops. Sorry about that. I need to move this over so that I can, in fact, get us to the right view. Okay. Thanks for all your patience. Okay, I showed you HealthFinder. Some of the other free things available to you that are essential to a good health and wellness collection that's online is Hospital Profiles, which lists almost all of the hospitals in the US, as well as other healthcare facilities, and provides you with directory assistance as well as grading and directories to individual staff, such as the director or the bursar, people like that with whom you might want to be in touch for planning purposes. The value of Hospital Profiles to you in the reference collection is for those of your community members who are trying to help someone who is remote from them, a family member who lives in a different state, for instance, to find appropriate health care or appropriate life support care when you cannot be there to take them into their own library to find it. And the insurance glossary is another kind of surprising thing that still lives from the federal government online. It's part of the healthcare.gov site, and it provides terms that are frankly quite hard for most of us to understand when they're used in a health insurance context. So having quick availability to that glossary can be of great benefit to you as well as to one of your community members. Probably the biggest and best of the whole bunch of free sites is the database, and it's a highly nuanced database Medline Plus. Medline Plus addresses a wide number of, or a wide range of different kinds of users. So it addresses the needs of clinicians, it addresses the needs of researchers, but it also addresses the needs of people who are trying to become better informed about their own information holdings in things like herbal supplements, or what the steps are going to be of a surgery that they're going to have on their knee next week, or why it's a good thing to have childhood vaccines roll out in a specific order and at specific ages. All of those things are available to you, and I frankly am so startled about how responsive the staff at Medline Plus have been over the years. I was once teaching a course in which one of the class participants came across a piece of information in Medline Plus about juvenile diabetes that had only recently been shown to be out of date. And by very recently, I mean within that month. And so she found a place in Medline Plus's site that called on, this was the point at which you could contact them. She contacted them during the course of the 3-hour class that we were in. And by the end of the class, she'd been contacted back by them with a thank you and with assurance that it would be researched and amended within 24 hours. But in point of fact, it was amended by that evening. So just the level of response is mind-numbing, I think. I mean, can you imagine if we as librarians were able to take on and do that in every area? We'd be superstars. You also need to think, though, about how the database and website choices you make actually fit your community. If you're in a community, for instance, where there is a high concentration of military veterans who are without their own access to the internet in a reliable fashion, other than their phone, which has a very small keypad on it, you might want to make sure that you do have a station set up within your library at a full computer that guides them to the Veterans Health Administration, because virtually every service that the Veterans Health Administration provides, and they do provide a huge number both for veterans and for military dependents, but all of those services require online interaction. You can't get the services with a phone call or a visit to a geographic location. So if you do have that kind of population, you want to make sure that your collection, so to speak, includes that access point, and that it's ready and identifiable, pre-bookmarked, perhaps an icon on the screen. Just make it as simple as possible for people to find it. Kids Health is published by an organization called NEMERS. And one of the valuable things about it is it actually has 3 different portals. It has a portal that is for parents, it has a portal that's for teachers, and then it also has a portal that's for kids themselves. So if you have a child, say a 12-year-old, who is interested in finding out what they can do more expeditiously about their emerging acne, here's a place where you can get kid-friendly information that's thorough and reliable, but is also addressing them in a manner that is appropriate. Okay, let's get back to that. My community wants only books. First, check your assumptions. In point of fact, most people are in the United States are actually looking online to find high quality information today. Be sure to read Pew Research as frequently as you see any announcement of the latest report on connectivity in the United States. Most people do rely on smartphones for their connectivity, so it is more difficult to see very nuanced and complex websites on a phone, which is one reason why you still need to have plenty of in-library access to full computers. But don't be surprised that people are more than willing to use computer skills and grow new computer skills than they were 10 years ago. Spend time teaching those computer use skills. And one of the wonderful things about health and wellness information is that it's exactly the sort of topic that inspires engagement. And so you can teach a whole lot about website evaluation and help people understand things about databases and differences between databases and websites, and how many databases have embargoes on information for a certain period of time, and so forth and so on. It's the perfect time to teach all that stuff because people really want to take care of their own health and the health and wellness of their loved ones. So they are engaged and they're ready to learn it. And what they learn related to health and wellness, they'll be able to take elsewhere as well and into their other researches as well. Leading beyond people's comfort zones can be uncomfortable itself. But think of it in the same way that you would think of teaching someone how to cook or how to clean house or any other skill that's fairly necessary if you want to be able to live independently. Consider how you yourself would want to be approached and design a skill-based workshop that is respectful and also touches on things of high interest from your community's standpoint. Earlier, I had mentioned the environmental impact reports that may or may not be in your collections. If they're not, you might want to find out where they are located and help people understand why they're important for them to have access to and what kind of information that things like environmental impact reports will give them that can lead to making healthy choices, or at least informed choices. We have an exceptionally long question and answer period, but we do have one. So we can turn to that now.
Well, we have a lot of questions.
So. Oh, wait a second. Sorry.
Sorry.
One more slide and then we'll get there. And this is just basically a reminder that Google is not the answer. This is why I've given you specific URLs to go to, so to save you time and also to make sure that you're going to well-evaluated sites. There is one other thing in a bullet point here that I want to point out to you, and that is that you can find app evaluations related to health and wellness too online. And this also would form a great topic for an in-library workshop to help people increase their skills in doing health and wellness research, learning where to find good apps. And now I'm ready. I'm sorry about that. Okay, Bobby, shoot.
All right. All right, so I'm just going to start at the ones that were asked first and sort of work down the list.
Okay.
Someone is interested in discussing the outdated health collection. The health titles are not updated frequently, and sometimes the information in the book, they're saying sometimes the information in the book doesn't change much. I think this is the point where you were suggesting meeting those items.
Yes. I'm not quite sure. Well, there are a whole lot of health and wellness books. Basically, the areas that I pointed out, which are things like human anatomy, are the ones that don't change much. A lot of other things do change very quickly. You're just not probably as aware of it as you might be if you were actually a nurse or an EMT or were otherwise in a health field. It takes a book at least 2 years from inception to publication So by the time a book is published, the information in it tends to be at least 2 years old already. So if you add that to the publication date, you're looking at something that's rather older. If you're thinking about something like the Physician's Desk Reference, which comes out every year and talks about drugs, one of the things that the print book itself cannot tell you is what drugs have just been approved for uses in different ends than the ones that showed up in the current PDR. However, if you look online, you will find that information. So I'm struggling to imagine that there will be very many books in your health and wellness collection as such that are older than 5 years for which the information really is good enough.
Yeah, and I would agree with that when I teach the Stand Up for Health and other classes for public librarians. We definitely recommend reading anything over, I think, 2 to 3 years, especially anything related to sort of like chronic diseases, et cetera, that it just is out of date too quickly. And I know that's unfortunate because sometimes those books can be expensive.
Well, it's back to that steak and champagne dinner, though. You have to be grateful that you had a good dinner, and then just understand that having what's left of that dinner now is probably not going to serve you all that well.
Yeah. So the next question is just, will they be getting the slides? Are you going to share your slides?
Yes.
Okay, yes. There we go.
And Bobby, do you have the current ones, or should I resend these?
Go ahead and resend them. Yeah.
Okay, I will do that. I'll do that today.
Okay. The next question is, does that mean you shouldn't purchase diet books that have questionable science at all? Should you just not be purchasing those?
I would not purchase them. I would not purchase them for the same reason that I would not purchase any nonfiction, something that's labeling itself as nonfiction, for a public library situation in which there was no expert opinion behind. I, for instance, have the mechanical aptitude of a snail. If I were to write a book about how to repair your automobile, I could write a quite nice one because I've answered a lot of reference questions about it. But I am no authority, and if you were to buy that book just because I wrote it, it would not serve any of your users quite well. So really do go by reviews when it comes to that kind of material. And I don't mean just reviews. I do mean reviews in library and professional journals like that, but also reviews that you will find from organizations like the American Heart Association, Diabetes Association. All of those health and wellness organizations do list titles that they have found to be okay. So you should be able to find plenty of things there. Now, there's the question of, but people are asking for, such and such a diet. Okay, if it were fiction, sure, you probably would, buy what somebody asked for. It would not be unheard of for you to buy what was asked for in the way of new science fiction, new mystery, new short story collections. However, when it comes to science information that is not evidence-based, it is no more a favor to your community to buy that than it would be to buy books in a language that no one in your community or very few people in your community had any passing acquaintance with. It doesn't help them. It doesn't add to their store of ready information. Much better would be to help them by showing them why you're not buying it, showing them the evidence-based criticism of that particular diet book, etc. If you have in the past, and all of us have, collected diet books for years and years and years and years and years in libraries, and these are the things that are very hard to weed if you're weeding only based on circulation, because of course they have high circulation. So you need to cut through that noise and say, no, they're not evidence-based. They are not actually providing the information that they promise to be providing. People can find all kinds of fat information now online without filling our shelves and making it difficult to find the good stuff. You can also think of it that way. How hard do you want it to be for people to find the valuable stuff because you've allowed the not valuable stuff to take up room?
Great. And the next question is that when weeding outdated circulating materials, sometimes they keep older stuff because there's no good new alternative. This is particularly common. They have a fairly elderly population in this part of where they're at. They're not comfortable with technology. I guess it's not really a question, but maybe you want to respond to the comment.
Okay. If I had a 5-year-old who was not really comfortable eating his sandwiches, but really liked eating his cupcakes, I don't think I would serve him just cupcakes. There are a couple of things going on here, so let's unpack this. Providing older information to people because it's in a particular format is not okay. It's not ethical. It's saying, because you're an older person, I'm not going to give you the good information. I'm just going to let you make do with this old stuff that's outdated and maybe it's wrong, but I'm not even going to look at that because I'm much more interested in the fact that it's in a format that I think that you will prefer. But go to those Pew reports and see how much of the population under the age of 85 actually is feeling more and more and more comfortable using computers, having smartphones, etc., and making sure that it's not an age issue, or making sure that what you have identified as an age issue actually is an age issue, as opposed to, is it a training issue? Is it because when computers became endemic and the World Wide Web was developed, these people were in their 40s and they were resistant, thinking that it would be a passing fad. And now, it's 30 years later and hey, it's not a passing fad. And so some of them are kind of in an ugly spot right now because they, at a point when they could have kept up, they didn't. So it's your job actually now to maybe develop a workshop that is specific for people who kind of missed a critical 25 years of computer development. Not by making them listen to the whole 25 years of development, by showing them here and now what information they can find at their fingertips, and the fact that this is real information, good information, appropriate information to their questions, as opposed to outdated information in a format that you think, and perhaps they think, is the easiest, most comfortable format to use.
Okay. The next question is recommendations for websites for health statistics. Any that are more or less reliable, especially for addiction statistics.
I'm sorry, especially for what statistics?
Addiction, substance misuse.
Addiction, yeah. Okay. Actually, look at the sites that I shared earlier, that suite of tools from the Public Library Association and the Medical Library Association, what they've put together. You'll find a whole lot of great information at those sites, and they're in the slides, so you'll be able to go to them readily. There's a quantity of addiction information out there. Bobby, I don't know if you have some off the top of your head that you want to share?
Yeah, I have a couple that we usually teach. CDC has some great stats.
Yeah.
And they do have a whole section on opioid misuse. I'm not sure if that's the particular health one that you're looking for, or the particular addiction you're looking for. Another that we recommend is the Kaiser State Health Facts.
Yes.
And that has some good information. There is also a website called countyhealthrankings.org that has some good information. The Census Bureau does have some good information. Not one we think about, but it does. And then if you're in a rural area, ruralhealthinfo.org has some good information. And I've made myself a note to put this in the email list. So
great, thank you. Thank you.
Okay, let's see. This is a general question. What is everyone's input about the health books published by Mayo and Cleveland Clinic? They're great and reader friendly, however, they don't update often. Are there similar publishers like this?
Actually, Mayo has a great website, and that's in the toolkit that you'll see from PLA and MLA. And yeah, they don't update the book as much as we'd like, but keep in mind that, it takes 2 years just to get it out on the street. So is an updated book really what you're after? Or are you after the current information? So do look at their website, because it can serve as an up-to-date version of that. And it has the same accessibility. And yes, it is wonderfully accessible. And back in the day, before we had an appreciable understanding of the importance of health and wellness information being up to date as well as highly evaluated and science-based, that was the cat's pajamas, but not so much anymore. And I'm sorry, what was the other one?
Mayo Clinic and Cleveland Clinic, yeah.
Cleveland Clinic, okay. Are other people commenting on this one?
No, I'm trying to keep track of what's happening at the bottom and keep scrolling. Let's see. I'm not sure about this question. It says if there's one fee database you would recommend that provides the most up-to-date information, what would it be? But I'm wondering if it's not supposed to be free database.
Yeah, I mean, I would start with Medline Plus every time, just because it can take you in so many different directions and has so many sub databases in it. But it is free rather than fee-based, and I'm not sure the advantage of paying money for something that isn't as good as it, what that advantage might be.
So, and somebody did then say, if there was one database that you were to buy, which would it be?
I wouldn't. I would stick with my Medline Plus to my dying day. There are other ones that are from the federal government besides that one that so far have not been disarranged by policies. So as long as they're there, I say use them.
Yeah, and I definitely, I second that. The nice thing about Medline Plus is that if you're teaching it in the library and someone goes home to use it, there's no login required. They don't have to remember any special information.
Right.
And all the information has been vetted as you talked about.
And there are tutorials that are readily available online too. So if you're trying to plan a workshop, you'll be able to find a lot of help for yourself in how to roll out that workshop.
Yeah, and then you can always contact me or someone else at one of the regional offices, and we'd be happy to give you. One of the other things too about Medline Plus that I like to highlight is that if you use the print function on the page, it actually produces a really nice printout for those of you that are worried about having print resources. And my recommendation is that you print from Medline Plus for free. So there's another.
Another thing is that website, that database, that particular tool is fully made in Spanish as well as in English.
Yes, that is true. There's a discussion that, yes, Physician's Desk Reference is no longer available in print. It has a website and an app now. There's a question about health books in Braille or large print.
That's interesting. Braille is an interesting topic in and of itself because Braille readers tend to be people who have been blind from their whole lives because of the required sensitivity needed in the fingertips. It's very, very difficult to learn Braille if you have had a previous life using your fingers to do things like wash dishes for 50 years or be a carpenter. You know, you've lost that kind of sensitivity that you need. So typically blind people these days are not relying on Braille unless they have a lifetime disability that is going back to the beginnings of their lives. And most states will supply whatever materials are needed. So and that is a function of typically of the state library. If in the few states that is not a function of the state library, you can go directly to the National Institutes of Blindness, which is part of the Library of Congress. So large print is an interesting one because instead of concentrating on health books in large print, which are going to be out of date, they just are going to be out of date because they're not going to be printed any sooner than non-large print books. However, do look at your large print cookbook collection and see if it is sufficient and if it's up to date. Really do a good job of weeding it and also feeding it. That's a collection that often gets overlooked.
Okay, and the next one is, in other webinars, we learned about creating disease kits for common conditions, diabetes, high blood pressure, Alzheimer's. Are you recommending that we provide pathfinders to websites versus print/DVDs?
I would recommend creating pathfinders, yes. However, in terms of DVDs and video, I would make sure that the DVDs are up to date in terms of the information that they contain. But I would not eschew the DVD format in and of itself. I would evaluate the content rather than the format. From time to time, Kaiser makes wonderful sets of DVDs on specific chronic conditions. However, they rarely update any of those sets. So if you get it while it's hot, great, use it. And then when it's out of date, make sure to stop using it. But certainly your Pathfinder should include video because that is a really important way of getting some information across. It's a much more reliable way of getting some information across than simply text, whether it's text online or text in print. Use multimedia. And it's not just because some people can't read so well. It's also because there are some concepts that are actually much easier to express as well as to understand if you can see and hear at the same time. If you can see a function, if you can see an activity and have it explained, for instance, the surgical process. And you will find that Medline Plus, among other databases that we've recommended here, has video content. So certainly this is not a text only, but the text is online. It's definitely multimedia. It is valuable.
The next question I think is it's for somebody is asking about if these disease kits are for public libraries. And yes, that is a thing. If somebody wants to know more about that, feel free to send me an email. My next question is, they want to know how I would compare the National Center for Health Statistics to the others I mentioned. The National Center for Health Statistics is part of the CDC, and I don't think it drills down county by county the way the other ones I mentioned do, which is particularly helpful if you're looking for things that are you want to focus on in the population you serve. So it's a good resource for a general overview. I think it's great.
It's good for students who are taking a more global approach, whereas the county by county is is what you need as a service provider.
And that looks like there's a little bit of discussion about the PDR and some American Printing House for the Blind and Talking Book Services, but I don't see any other questions. We've got about 4 minutes left, so if somebody has anything that they haven't I missed or that you like to ask, go ahead and put that in the chat box. I think this was great. Thank you for doing this.
Thank you, Bobby, and thank all of you. I'm so glad you asked questions.
Oh, yes, I did miss one. Is the drugs, herbs, and supplements section of Medline Plus a sufficient substitute for the info available in the PDR?
The information that was available or is available in PDR was never intended for the end user patient. It was intended for physicians to identify the pharmaceutical properties of things that they are not pharmacists, so it's not their first skill either. The drugs and supplements as portal in Medline Plus is exactly what both physicians and consumers need, because it does explain things like generic name versus brand name, the amounts of dosage, why something would be prescribed, how it functions in the body, how it interacts with other things, including things in your diet, what sorts of side effects can you expect, what sorts of side effects should you report to your doctor, what sorts of side effects are relatively common, what ones are rare, et cetera, et cetera. And because non-prescription drugs are also included and because herbals are also included, there's actually much more information than in the PDR. And it's all, provided in a consistent voice. So you're not having to have 4 different books open in front of you and trying to function with 4 different indexes, and one that's written in a conversational style and one that is just bullet points, et cetera, et cetera. It's much more balanced.
Yeah, I would say too that if you're looking for some sort of information you're not getting on Medline Plus about drugs, particularly, there's a resource from the National Library of Medicine called Pillbox. Excuse me. That is good. It will help you identify a pill by searching for the shape or the color, which I think is one of the unique features. And then there's a resource called the Drug Information Portal, and that tends to more have the information, excuse me, that you might find on that printout that you get when you pick up your prescription and then throw away without reading.
When you regret it, you can go look it up here.
Yeah, so there's a couple of good resources. Somebody asked about the county statistics source. I made a note. I'll send those websites I mentioned when I sent out the email with the slides. All right, I don't see any questions, and we're right at 2 o'clock. So thank you, everyone.
Thanks for watching. This video was produced by the National Network of Libraries of Medicine. Select the circular channel icon to subscribe to our channel. Select a video thumbnail to watch another video from the channel.